Moving to Spain and worried about healthcare, public versus private, health insurances, copay, the cost. This can be overwhelming, but don't worry, we're gonna break it down for you and make it really simple. So let's talk public healthcare in Spain. If you're moving to Spain, you wanna make sure that you and your loved ones are covered. What I mean by that is that you wanna make sure that if something happens to you or you need some sort of operation, you get sick, you wanna just go in for a GP consultation, that you are covered and have that stress-free feeling. So in Spain, you'd have two different options. You have the public healthcare and you have the private healthcare. Let's start talking about the public healthcare. Public healthcare in Spain is ranked as one of the top healthcare systems in Europe. And that's actually something which a lot of people are surprised about. Spain has a great healthcare system. There are essentially two ways to access public healthcare in Spain. Number one is if you work for a Spanish company or you're self-employed in Spain, you're automatically covered by the public healthcare service. You do not need to pay additionally in order to access the services. Option number two, if you legally reside in Spain and you're not employed by a Spanish company or you're not a freelance legally, you can also pay to access the service. Now, this cost varies on your age, depends on where you are in Spain, but it ranges anywhere from 60 all the way up to 180 euros a month. Now, this cost will only cover certain things such as consultations, but it will not cover treatments in some aspects of it. It depends on what we're talking about, but it's really important to get professional advice before you come to Spain. But generally speaking, those are the two options you have in the Spanish public healthcare. That takes us onto private healthcare. Private healthcare has become ever increasingly more popular in Spain, and especially when it comes to relocators, as in some cases you are required with your visa application to have a private health insurance. Private healthcares in Spain are scattered around, and you have two kinds of services or two kinds of establishments. You have the private hospitals and then you have the private clinics. Private hospitals, centers like Quirón, among others like Hospiten, are scattered around Spain and offer a variety of different specialties from the most basic to the most complex, and do everything from small consultations to big operations. Healthcare insurances normally cover access to these private institutions. Then separate to this, you have clinics, and clinics are scattered around. You have different specialties which are normally covered by your private healthcares. Now, let me tell you guys what it practically looks like to live in Spain. For example, in my case, I have a Spanish public healthcare coverage and I also have a private health insurance. When do you use what? Well, in my case, I use one or the other depending on what it is I need. When it comes to private GP consultations for a cold, I don't know, something simple, you'd go to your private clinic or your private GP because it's a matter of speed. Although the Spanish public healthcare is great, it can be very slow with very long waiting times. So even Spaniards like myself opt to private health insurance for small matters. And then when it comes to the bigger matters, normally the best surgeons or the best doctors and specialties operate in public clinics. So if it's something more serious, you normally get derived or you go to the public healthcare. Public healthcare in Spain is really fantastic. I can tell you myself, I have two small and young kids, and in this case, we use a combination of private and public, and we feel that our needs are totally covered.